I'm Kelly Warner. Summer officially kicks off this week, and lots of families have plans over the next couple of months. You can't always prevent summertime injuries, but you can help treat them by having a well-stocked first aid kit on hand. From cuts and scrapes to sprains and bee stings, be prepared for summertime injuries with a pre-made first aid kit, or create your own kit.
Don't forget, we need some of the basics.
Pediatrician Dr. Pilar Bradshaw says even the simplest first aid kit should contain Band-Aids and antiseptic wipes and ointment.
It should have a numbing spray that helps if your kid gets a burn or has a cut or something else that they are in a lot of pain. Also having some Tylenol, ibuprofen, Benadryl, some antihistamines in case your child has an allergy or is having some sort of allergic reaction.
If you have a family member with a history of severe allergic reactions, don't forget an EpiPen. Include an ACE elastic wrap to wrap an injured arm, knee, or ankle. And bottled water is helpful for cleaning wounds.
Frozen water bottles are a fantastic little item to bring along on a trip. Not only are they great as an ice pack, but as they thaw, they can be really nice to have to rehydrate yourself when you're out and about in the summer heat.
Dr. Bradshaw says don't forget sunscreen with an SPF of 30 or higher, and she recommends using a mineral-based formula on young children. Also, be sure to include insect repellent.
It's helpful to have spray that contains DEET to really keep mosquitoes and mosquito-borne illness away. I often tell parents, spray the DEET on your clothes and let them dry rather than spraying it directly onto your kid's skin.
There's no guarantee that your summer will be mishap-free, but having a first aid kit on hand will help if something does go wrong. Be sure to refresh your first aid kit each season because some items may have expiration dates. For a complete list of items to have in your first aid kit, head to eugenepeds.com/healthykids. I'm Kelly Warner.